to you today on health policy development and research supporting this, and then a little bit about some work that we're doing at WHO on this. At WHO, we use this framework when we're looking at health policy development. This is probably something that you've seen before. Our objective, of course, at WHO, our general policy direction is always going to be universal health coverage. And what we aim for, of course, is always better health outcomes. So this is the sort of end goal of the work that we do. So we're looking at better health outcomes, better health security, health equity, social inclusion and participation. And in order to support this goal of getting better health outcomes, we look at what we call the health system's building blocks. One of them being service delivery. This is, of course, key in supporting better health outcomes. And here we're talking about people-centered, integrated, high-quality, comprehensive service delivery. And what we do need is better guidance in this area, especially when looking at safe and cost-effective interventions, and especially adapting service delivery models to different settings. At WHO, we are working on a WHO strategy in this area. And I think we have quite a lot of knowledge about what doesn't work and some knowledge on what works. But where we have huge gaps is translating that into practice, so the implementation. How do we get from the what to the how to? Also very important are critical subsystems here that support service delivery. These are very technical areas: health financing, health systems, workforce, medicines, technology and infrastructure. And these are also areas where we need to provide balanced input to support the health system, and we have knowledge on what works and what doesn't work, perhaps less on what works and more on what doesn't work, but as I said, we have gaps in the implementation, especially to different contexts and country settings. An overarching theme, of course, for all of the building blocks is the governance area here. And two key inputs for better health governance is inclusive and participatory policy dialogue and reliable and good quality strategic information to help those who govern well with the overall policy direction of universal health coverage, primary health care, and health and all policies. But let's take a step back and look at public health in general and the three sort of components of public health. So we have the research, the policy, and the practice. And unfortunately, these three areas are independent niches with specific ideologies, specific norms, values, interests, and approaches, and three different groups of people. We've got the researchers, the policymakers, and the field practitioners that, as we know, don't really communicate enough with each other. And part of this reason is health policy is complex and it's messy. It's not a linear process. In real life, we've got various interests, interest groups, pressures, pushing and pulling on the policy process. Political parties, lobbies, private sector, civil society organizations, etc. And this means that the reality is difficult and not so easy to look into when it comes to research. So context, when it comes to health policy, matters a lot. We have a very unequal relationship when it comes to stimuli and change. You can put a small little stimulus and sometimes achieve surprisingly big changes. On the other hand, and we see this a lot, you can have multi-million-dollar programs aimed at really making broad changes, but the effects end up being minimal. So health reforms are broad, difficult, transformative, which is why this issue, it's why it's complex, and the context is so important with this huge range of interests and stakeholders. And these stakeholders all hold different bits and pieces of knowledge. And in order to really make health policy development relevant and implementable, we need to bring these different bits and pieces of knowledge together, and these knowledge holders need to come together. So each of these areas has very different knowledge holders, and in addition to this, in many countries we have other knowledge holders such as aid agencies, NGOs, etc. And what we need is a balanced dialogue between these different knowledge holders. So, as I said, context matters a lot, especially when we're going from this area, policy, to practice, but research obviously needs to feed into policy as well. And so when national policy decisions are made, the details, the devil is really in the details. So the details are worked out on the ground, and this is where, if it's not done right, then the context, because of the context and the institutional arrangements or the change, we often see that we fail. A dose of realism is very necessary, especially when looking at the acceptability and feasibility of policy options. So we need more knowledge on these policy options, on the acceptability and feasibility, and more on the how to rather than the what. And in this situation where context matters so much, evidence is only one little piece of the puzzle. And what's just as important in reality or in country settings are stakeholders' views and opinions. And this is even clear when we look at the definition of people-centered care that we use at WHO. Care that is focused and organized around the health needs and expectations of people and communities rather than on diseases. So we need that view of the people and communities. We need that input regarding the expectations of people and communities. And here I quote researchers at Johns Hopkins: "The best evidence is that which is experienced, learned, and acted on by key stakeholders in their own setting." And that piece of the puzzle need to come together, the evidence and the stakeholder opinion. So the different knowledge holders need to interact more with each other. So for me, really, the key question is, how can we stimulate and encourage these different knowledge holders to come together and interact? And how can we increase the participation of the population? And how can we get to the how from the what? And break the silos of knowledge that we have at the moment. Some examples here of pieces of research which I thought were very interesting and contributes a little to the body of knowledge in this area. The Alliance for Health Policy and Systems Research did some case studies where they looked at adopting evidence-informed approaches to health reform. And when we look at the success stories among these countries, there were some common factors that really stood out. And I quote some of them here. And one is that health researchers and health leaders, so we're looking at the researchers and the decision makers, both came together and were involved in advocating for health policy research and influenced the health reforms. There was a prominent role of press and public opinion, so we have that population component. The support of parliamentary standing committees. You could argue that these are representatives of the people, at least in a democratic setting. And we had orchestrated effort to embed research into decision making, to make that link between the research and the policy. So these kind of context-specific how-to studies, I think, are quite useful to help us understand better how can we bring the different stakeholders together and what kind of outcomes can we expect if we do so. Recently, an article was published on the case of Brazil, which has achieved great improvements in health status and life expectancy with the people-centered approach. And the key component or element in Brazil in their comprehensive national health system was the strong social participation. So what they have is national health councils in their local equivalent of a district health sector, and these health councils really set the direction for health policy locally and health management of the various facilities in the health sector. And what is very interesting here is that these councils are made up of not only health managers and service providers, but the end users, the community also has a strong voice in these councils. And every 4 years, health conferences are held, and in other settings, they might be called annual health reviews, which are basically conferences which bring together the various knowledge holders and those who hold the bits and pieces of information to frankly debate and discuss and set the tone for the next few years as to what the priorities are in the health sector. And lastly, a potentially promising and innovative solution might be using technology to build communities of practice. That is, communities of the different knowledge holders. And we have a few examples out there at the moment. The Harmonization for Health in Africa, or the HHA initiative, has very well-funded communities of practice for different health system building blocks, where they bring together on a managed knowledge platform government, donors, and researchers to discuss about specific topics. And this has actually made quite a bit of change and has had huge influence, especially in the health financing area when it comes to user fee abolition and performance-based financing. Now, in the HHA communities of practice, which has known some good success, they don't include end users, but in any case, it's an example of bringing together various knowledge holders who wouldn't come together otherwise to really build collaborative dynamics and build trust. And one platform that we use at WHO is what we call the Country Health Policy Process, or the CHPP platform. And we've had a good bit of success in Togo with this, where we've brought together on this platform a community of practice which consists of district health authorities, community health workers, end users, i.e. the population, and central level stakeholders in the capital, so the Ministry of Health, and to actually exchange on various topics via this platform. And it's been ongoing for about 1.5 years, 2 years now, and the last few annual health reviews have actually had much higher district level participation than we had in the past, and many of the Ministry of Health staff has attributed this directly to this knowledge platform. So we need more time to see how this goes and to see if this can be replicated in other settings, but this is potentially something quite promising. Thank you.